this is a big question, and and I always tell people to think about this, because a lot of places will say you got a guarantee or aftercare for 10 years or 5 years or lifetime or whatever, but you got to think what's included. So basically the things that you got to look at are the sort of coming to the clinic and talking to the doctor, talking to your surgeon, the having surgery, so that obviously if you're worried, you want to come and talk to the doctor about this, about your problem, about your worry. Then you got your surgery. Having surgery is going to incur costs. So how long are you covered or guaranteed in terms of that? And then if you have got implants, if it is a breast augmentation, I don't know what this is, but then obviously if there's implants or devices, the devices will have a guarantee on them or aftercare. So those are the things that you really got to think about in your own mind, and be comfortable in your own mind that you are being looked after. So I'll talk in general terms, not so much with what we do, but in general terms, what you've got to look out for if you're thinking of having something done. So after seeing the surgeon, sometimes people will charge for follow-up appointments. Some doctors charge for follow-up appointments. We tend to bundle it all in the price of the op, so you don't pay any consultation fees after surgery or before surgery. You come back and see the consultant as often as you want. It's all included at any time ever. You come back 3 years later, 4 years later. In fact, even if you come back for a different procedure, so if you come for a tummy tuck and you want to talk about breast implants in a year or 5 or 10 years, we don't charge for a consultation fee if you're a current patient of ours. So that's one thing you've got to think of. If you're going to have particularly if you have a problem, you have to come back every week, you're going to have to be paying £100 every week to come and see the surgeon, sort of thing. It's going to be a bit of a bind. But or if you have just a bit of a lumpy scar or problem with something in a year or 2 years, are you going to have to pay to see the surgeon to chat about it? Number one. Number two is implants. I know I said implants third, but I'll talk about implants now, because a lot of people say I've got a 10-year guarantee and stuff, but that's just the implants often. So all the implants we use got a lifetime guarantee. A lot of implants nowadays have a lifetime guarantee. Not all of them, but a lot of them do. But then you've got to think, what does that cover? Because it usually covers rupture. So the guarantee usually covers rupture. As I said a minute ago, rupture is normally not as much of a problem as capsular contracture. So it doesn't always cover capsular contracture. Some companies cover capsular contracture, some companies don't. Some companies, so when I say that they give you a lifetime warranty against capsular contracture or rupture, that just means they'll give you a new implant. They won't pay for you to have it put in. So you've got to think, that's not that helpful, because the implant's only a few £100. And so some implants will give you both. Some warranties will cover both implants. Some will just give you one. So obviously, if you want to have the other one changed, if it's been 15 years, you want to have the other one changed. Some will allow you to have a size change. Some won't. Some will give you money towards the hospital costs. Usually, if it's a rupture, they will give you some money, $1,000 or something, usually towards the hospital costs. Others don't. But then the ones that don't usually cover capsular contracture. So there's always a bit of a trade-off between the warranties. So the warranties are all, it's a bit of a minefield and it's a bit confusing. I think that's why you find a lot of people would just use the same implants, because they sort of know what their warranty of the implant they use is, because it's hard to know what the warranty of Allergan and Mentor and Nagor and goodness knows what, Polytech, and all the companies have all got different warranties. So yeah, some will just give you an implant, some will give you money towards the implant, some will cover capsular contracture as well as rupture. So that's the implant thing. And then the surgery is probably the big one. I think when people talk about, Dee, can you clarify what your aftercare covers with implants? Well, our aftercare here, specifically with the implants, not here. We tend to use Nagor or Polytech. Can use it if you want a different make, we can use a different make. But Nagor cover capsular contracture and rupture for life. So they cover both for life, but they don't give you any money. So they only give you implants. You have to pay for the hospital costs. Polytech cover rupture for life. They don't cover capsular contracture. I don't know why, because Polytech use polyurethane implants, which you've got a lot less risk of capsular contracture. So I wish they would cover it, but they don't anyway. but the risk of it is less. But the good thing, the thing about Polytech is that they cover you for 2 years. They will, you'll have the hospital costs covered. So talking about, am I rambling a bit? I hope I'm not. So the next thing you've got to think about is the hospital costs. So that's just the implant. They give you an implant. So what are you covered in terms of the hospital cost? So say if you have Polytech implants, they have well, it's not Polytech, it's Q Medical, who are the UK distributors of Polytech, offer a guarantee or a warranty, which covers you for 2 years, and that will mean that they will give you money towards the hospital costs. It's £1,500 per breast. We tend to just say that you're covered. So if more than that, we cover it. But basically means that you're covered for any surgery within 2 years of having the operation. That means if they're not sitting right, if they're sitting too high, too low, not quite sitting right, or if you get a seroma, or if you get a problem, basically, if they rotate, if they're teardrop. So that's Polytech. But then the hospitals have a sort of warranty. So the hospital, it varies between hospitals, so you have to check with the hospital. So with the two hospitals we use are BMI Priory and Parkway, Spire Parkway. BMI Priory in Edgbaston covers you for 6 months. Parkway in Solihull covers you for 12 months. That means if in 6 months or 12 months you have a problem, all the hospital costs are covered. You can have if they're sitting too high or too wide, or if you have a dog ear, say if you have a tummy tuck and you've got a dog ear, like the little bump at the end of the scar, or you get a seroma and you need to have it drained, or a hematoma and you have to go to the theatre, or anything like that, they will cover you, so you don't have to pay any of the costs. But if you need surgery after 6 months or 12 months, depending on which hospital, you will have to pay the surgical costs, the hospital costs. See, it's even hard for me to explain. I'm not sure if I've explained that well, but it's not as clear as I think sometimes people just like saying, oh, 5-year warranty, oh great, I'm sorted for 5 years, and you realize you just covered for the implants, but it's important to clarify. I don't know if I've clarified it very well there, Dee. I hope so. But it is a thing